Hi, I'm Jonah Essers, and I'm a pediatric gastroenterologist, and I am thrilled to be collaborating with the FPIES Foundation to bringing a series of videos on important topics in FPIES. And today we're going to cover acute FPIES reactions and your emergency game plan. And just as a brief overview or reminder, acute FPIES is heralded primarily by gastrointestinal symptoms that come on shortly after an exposure, usually within a couple hours. The symptoms are relatively short in duration, with most kids feeling better within the day. And the symptoms are reproducible, and the food trigger is relatively easy to define because of its close proximity to when it was eaten to when they have a relatively dramatic reaction. And if the reaction is severe or is long in duration, the child can be at risk for dehydration. And if that dehydration is not corrected or is allowed to persist, in rare cases, a child can go into shock. And that's the reason you want to make sure to have an emergency plan in place in advance. And so when a child has an acute FPIES reaction, the most common symptom is vomiting, which can be short in duration or many hours in duration. There's usually some sort of abdominal discomfort or abdominal pain, and occasionally there will be diarrhea and or a rash. When the symptoms are quite severe, the child can get dehydrated. Signs and symptoms of dehydration include sunken eyes and sunken fontanelle, dry, cracked lips, decreased urination, decreased skin elasticity, a poorly interactive child, and crying without tears. And if the dehydration is not corrected for, in rare cases, a child can go into shock. Signs and symptoms of shock include pale skin, lethargy, listlessness, a weak pulse, and cool skin. Shock is a medical emergency. So, the first thing I like to have families do is to feel like they have a number that they can call in case they aren't sure what to do. So, if there's the dilemma of whether you should go to the emergency room, whether we should try to feed the child or not, reasonable to check in with the doctor that knows FPIES the best. So, for some families, that might be your primary care physician. For others, it will be your pediatric gastroenterologist or your allergist. And if you truly think there's a medical emergency, call 911. You want to make sure that you have designated in advance an emergency room that you might go to, because when you're in the heat of the moment with somebody with severe symptoms, you don't want to have to go through these sorts of thoughts. You want to have this discussion with your local physician who knows what resources are available in your town. For instance, the advice might be just to go to the very closest emergency room in town. For others, it might be to drive a little bit farther to go to the emergency room that has a good track record taking care of critically ill small children. And next, I like to make sure that families bring some sort of documentation with them. If you go to fpiesfoundation.org, the FPIES Foundation has a letter that you can download for free that is essentially a primer for emergency room doctors on how to manage an acute FPIES reaction. And the reason for this is that many ER physicians have never heard of FPIES before. Keep in mind, this is a relatively rare condition still. And even if they have heard of FPIES, they may not have taken care of many children with FPIES. So this is a polite but expeditious way to get everybody up to speed in the emergency room on what needs to be done first. Other things you can bring for documentation include a list of food allergies, as well as other medications that have been tried in the past to stop a vomiting reaction that may have occurred. And then lastly, you want to make sure that you're continuously reassessing your child. And that goes both ways. If you've decided to stay home from the emergency room and you are at home trying to manage this, continuously reassess whether your child's able to start drinking and eating, whether they're perking up, whether they seem a little bit more comfortable or not. By the same token, you may be heading to the emergency room and you may park and you might be ready to get out of your car and realize that things seem a lot better. And you may be tempted to want to just see if they can have something to drink and maybe avoid the emergency room. That does happen. If you're in doubt, you should absolutely go into the emergency room, but it may be that you reassess and realize that things have gotten better. So continuously reassess. And this is an example of the emergency room letter that you can download courtesy of the FPIES Foundation. And it's something that you can fill in your child's food allergies directly into there and keep it with you when you go to the emergency room. So I'd like to talk for a second about why I think it is that emergency room visits are so challenging for families with FPIES. On the emergency room side, often providers have not heard of FPIES or they don't understand FPIES. Occasionally, there are providers that are not comfortable with critically ill children, and sometimes it can be hard to communicate with a physician that is very, very busy. From the family side of things, this is very scary to have a unpredictable, severe reaction to food. It's also very frustrating, especially if your child has had multiple reactions over a period of time. And then lastly, this is exhausting. So I like to coach families to have a little bit of grace. Have some grace for your emergency providers and bring them up to speed so that they know what needs to be done for your child. And then also have some grace for yourself and for your family members because this is really challenging to manage. And we talk about ways that families can advocate for their child in the emergency room. The first one is to provide documentation. As we discussed previously, bringing the emergency room letter, a list of food allergies, or a list of medications that have been tried in the past that have worked in the emergency room. Second, to ask questions of the provider when decisions are being made. When you ask questions of a provider, you're not necessarily questioning their authority or their decision making. But in this case, be reasonable to ask if there are going to be any x-rays done. We try to avoid x-rays if we can because of the radiation exposure. However, they're often needed in emergencies. And we just like to make sure that emergency providers are at first thinking about FPIES 101, which is to establish hydration for the child, make sure that we've checked some basic blood tests like electrolytes, making sure that we're giving medications to stop the vomiting before going to bigger tests that potentially come with radiation. At the end of the day, you do have to take a leap of faith with your provider, and you should trust their judgment if you feel like that you've had your questions answered and you understand what's happening. Lastly, if you do feel like that there's some discrepancy in what you're looking for and what is being offered in the emergency room, it is reasonable to request that the emergency room physician contact the doctor on call for the practice that manages your child's FPIES. So that could be the primary care physician, it could be the pediatric gastroenterologist, it could be the allergist. So that's a way for professionals to talk with other professionals and have a consultation on how to best manage your child. So the final pearls that I want to leave you with is that acute FPIES is very scary and unpredictable. However, you will know your child's food triggers, you will treat the reaction successfully, and you will see resolution in this problem with time. Thank you so much for listening.